Patient is conscious, oriented to time, place and person, not anemic, not jaundiced, no cyanosis, no clubbing, no generalized lymphadenopathy, no pitting pedal edema. This is how our students by heart and present in the case presentation. When you cross-examine the students along with the patient they examined, most of the time we come to know that students have not done the general examination at all, or they have not done it properly. Because they do not know the importance of general examination. If they come to ophthalmology department, they think that examining the eye alone is enough. General examination is not needed. Today, let me say why general examination is very important. For the following points, general examination is very important to be done from the scalp to the sole. You have to start from the head and end at the foot. Complete general examination is a must. Because the disease you are dealing in the particular organ, that is the eye, may be a part of a syndrome. There are several syndromes in medicine. Syndrome is caused by genetic transmission. So, a problem in the eye may be a part of multiple problems in the body due to a congenital problem. So, it may be a part of a syndrome. Next, the disease in the eye may be a part or extension of the systemic disease. Maybe a part, or it may be an extension of a systemic disease. A patient having a miliary tuberculosis may have tubercles in the eye, in the choroid of the eye. Patient who is a diabetic may have a diabetic retinopathy in the eye. Patient who is having rheumatoid arthritis may have iridocyclitis in the eye. So, the disease in the eye may be a part of a disease in the systems. Next, coming to the management. General examination is very, very important for the management. I will tell you one example. If a patient is a cardiac patient who has a block in the cardiac conduction, patient is also a glaucoma patient, you are going to start the patient on timolol eye drops. Timolol is a beta blocker. If you start the patient on timolol for glaucoma, this beta blocker may block the conduction in the heart further and it may be deadly to the patient. So, for management too, systemic examination or general examination is very, very important. Let us see what are the things to be examined under general examination. The first thing we have to examine is the higher function. Higher function, you will not waste time because already we have taken the entire history of the illness. The patient has been conscious. If the patient is oriented to the hospital, if the patient is oriented to the doctor, the patient is oriented to the time of the day, naturally his higher function is normal. From the history taking itself, we know that patients' higher functions are very good. Next thing we have to look for is the anemia. Anemia can be observed in several parts of the body. One of the parts where you can see the pallor very much is the palpebral conjunctiva. You can just about pull the lower lid down like this and look for pallor on the palpebral conjunctiva. Next is the jaundice. One of the beautiful organs which becomes yellow in a patient who is having jaundice is the sclera of the eye. The eye is having a white. this white area in the eye becomes yellow in color. So this is the important part where you can diagnose a jaundice. Cyanosis, a person turning blue in color due to decreased oxygen levels in the blood. This can be very well observed in the mucosa. You can ask the person to open his mouth. You can see the oral mucosa becoming bluish in color. Once again, you can pull the lower lid like this and see for bluishness in the lower palpebral conjunctiva. Next is the clubbing. Clubbing is drumstick-like appearance of the nails. This is classically present in cardiac illness, respiratory illness. It is present in liver disease. So it has to be observed only in the nail. Next is the lymph nodes. In general examination, every part of the body should be examined for lymph node enlargement. Every organ is draining into a particular lymph node. We have already read in anatomy. If you consider ophthalmology, that through the eyeball drains into two groups of lymph nodes. The lateral part of the eyeball drains into the where? To the preauricular nodes. The medial part of the eye drains into the submandibular nodes. Without examining these two nodes, ophthalmological examination is incomplete. Next, look for the swelling of the foot. If there is a swelling of the foot, then you press the skin over the medial malleolus with your finger and look for any pitting there, pitting pedal edema. This is very classical of a cardiac illness or a liver disease or due to renal failure. So you have to look for pedal edemas. The next and most important thing in the general examination is examination of the vital signs. The vital signs are, one is temperature. Examining whether the temperature of the person you are testing is normal or not. You can just like that touch the patient and see whether the temperature is above normal or below normal. You can also use a thermometer to find out exactly what is the temperature of the body. Next is the pulse rate. You have to examine the pulse using 3 fingers. Already we have learnt in physiology. You have to count the pulse for exact 1 minute. Many people make a mistake. They count the pulse for 15 seconds. They multiply it by 4. By doing so, you may sometime miss on the diagnosis. A missed beat may be missed. The change in the volume of the pulse may be missed. So, exact 1 minute we have to count the pulse. Next is the respiratory rate. The movement of the chest on inspiration and expiration. How many times the patient is doing this chest movements. It is an involuntary movement. You cannot ask the patient to inhale and exhale and count the respiratory rate. You have to keenly observe the chest and its inspiration and expiration, and you have to count that for 1 minute. Next is the blood pressure. Blood pressure has to be examined for all patients compulsorily. Blood pressure has to be examined using a manual sphygmomanometer. You should never use an automated blood pressure equipment, measuring equipment. Sometimes you may miss a diagnosis. There is a disease which has 2 systolae. The automatic machine will detect only 1 systolic blood pressure. Only manual blood pressure equipment with using the stethoscope you can find out 2 systolic blood pressures, and that will lead to a diagnosis. Blood pressure has to be properly examined with the patient comfortably sitting, and the sphygmomanometer or the blood pressure equipment has to be exactly at the level of the cuff being tied around the arms. So it has to be done properly. You can measure blood pressure in all the 4 limbs also. It will tell you whether the blood flow is normal to each of the limbs or not. Similarly, pulse rate has to be counted in all the parts of the body. By counting the pulse rate in all the parts of the body, you can know whether the blood flow is normal to all the parts of the body or not, particularly the limbs. So these are the vital signs we have to examine. Ophthalmology being a broad specialty, general examination should include all the system of our body. General examination should include the cardiovascular system. You have to examine the heart. At all the 4 areas, you should hear the heart sounds. Whether the first and second sounds are normal, whether there is any added sounds, you have to properly auscultate and see. Next is the respiratory system. Once again, respiratory system, we have to auscultate all the lobes of the lungs properly in their exact anatomical location to find out whether there is a normal vesicular breath sounds or there is any abnormal sounds. You should examine the abdomen properly, make the patient supine, keep the lower limb flexed and just palpate the abdomen in all the 9 quadrants and look for any abnormality. If the abdomen is normal, it should be soft. Next is the CNS, central nervous system. You should examine the higher functions, we have already done it. Motor system, then is the sensory system, then cranial nerves, autonomic system. All systems has to be examined in CNS. Our teachers used to say, while a patient is walking in the corridor of a consultation room, from there itself they can diagnose a disease in the patient. This neurological examination can be done as soon as the patient has been seen by you, by the way he talks, by the way he walks, by the way he behaves. So, you can observe those things and come to a conclusion whether there is any abnormality in the central nervous system or not. Anyhow, we have to examine all the parts of the central nervous system. Other systems, we have to examine the orthopedic system, we have to examine the endocrine system, we have to examine the skin fully. We have to look for any infective focus in the body. Infection can be in the tooth, infection can be in the nose, infection can be in the ear, infection can be in the skin, foot, infection can be in the genital areas. It is very, very difficult to find out infections in important areas like genitourinary areas because our people never reveal about that to other specialists. So we have to particularly ask the patients whether they are having any problem in their genital and urinary systems in the areas nearby. It has to be very confidential. Suppose a patient is having a fungal infection in the genital area, you do a cataract surgery in the patient, will not this fungal infection go into the patient's eye? It may, because the patient may be scratching over the fungal infections and the fungus may be carried in the fingernail buds, and when the patient is applying eye drops, it may be transmitted to the eye, causing a fungal endophthalmitis and loss of vision. So, patient should be examined as a whole in general examination. General examination should be done truly, properly, because there is no alternative for this. If you do that properly, then definitely your local examination and your diagnosis and the management is going to be very, very easy. Thank you, friends. Let us see in local examination in the next video.